of give you a little bit of an edge, but not a whole lot. Look at this. I'm going to have you take that off.
Okay, this is an actual.
That's got
Okay.
4 implants,
I'm not exaggerating. Okay,
Yeah.
so that was good. Okay, so underneath here, there's little holes.
little clips.
So under the denture,
Yeah,
you make little clips, and then these are 4 implants that just snaps on.
right.
Do they ever have a tough time taking these out?
Yeah, that's the point. We want them to have a tough time taking it out.
Okay, so the levels though. Okay, so you could have 2 implants, snap in, snap out. What's the next level up? 4 implants.
We go to 4 implants. We can go to 6 implants to where we don't have a denture. We could just put teeth over them.
So a full arch of teeth.
Full arch of teeth.
with 4 or 6 implants.
Yeah, and we can just screw
That's what
them
everybody
on,
wants,
cement
though.
them on.
That's what everybody wants, right?
Well, there's advantages to everything. It depends on the person, because over time, you lose bone, and it gives you that sunken look. Your lips kind of sink in. So to have a denture, the plastic pushes your lips back out. It makes you look younger.
Okay.
You've got the youth back in there. What makes you look old is that sunken look. Okay, so now if you just put teeth without the plastic as a denture, you're still going to have that sunken look. So there's advantage. Some people, depends on your age, obviously. If we can preserve as much bone to where you don't have that look, we can just put teeth. But if you've gone past that, where you've lost a lot of bone, and you're up there in years, then we want to put that plastic there to bring everything back out and give you that the beautiful smile that you had when you were younger.
So there's a cosmetic component to this, though.
Oh yeah, there's various
Appearance
aspects.
component.
Everything is appearance again. Now, if you're dating, you're single, it's kind of embarrassing having that situation where you have a denture and you got to take it out.
70 is very young today. These people are still. I mean.
Oh
70
yeah,
is young.
absolutely. You could make the argument 70 is the new 60, and I don't think that's old at all. Even 70. I don't think there's a good time to have a denture, period. You can't resign yourself to that assumption, because I'm 70, it's okay to have a denture. Granted, if you already have a denture, you can still get away from traditional fit, feeling, quality of life. You can improve all of those on every aspect. Just walk into your dentist. Ask what the options are. Find out what your options are.
Can these look real?
They can look your absolutely.
I mean, are you part of that design process too? Because I know you're also a cosmetic dentist.
And that's what we design in our dentures as well. The same concepts that go in the shape of the teeth, the size of the teeth, the proportions of the teeth, the color of those teeth, what's right for that person at that age, the shade of the gums that go in there. We don't want anything to look unnatural. If someone turns around and looks at your teeth and goes, there's something off, we haven't done it.
Can you spot dentures, by the way? Denture wearers?
I can a lot of times. Sometimes it's only because of the look of the denture, but a lot of times it's because how that person is talking with that denture. It's subdued. It's almost crimped in because they're trying to hold that denture in place. They don't want it flying out while they're talking. Now, you got implants that hold the denture in place, and that's not going to be a problem.
Now, I think you told me that some people, when they get married, their spouse has never seen them without a denture, or their spouse doesn't even know they have a denture.
Yeah.
Is that right?
That is exactly right. And the thing is, if you don't have any implants, what you're doing is the plastic has been hammering your gums and bone all day. That's why we recommend taking it out at night. But now when you're just newly married or
You don't want to take it
dating, you don't want to take it out, because it's embarrassing to show that other person that you have dentures. And so they further exacerbate that problem, where the denture is there all night. Now the gums don't have a chance to rest and breathe and recuperate, revive at night, the beating that they're taking during the day, and it just accelerates the problem even more.
Okay, now on the upper arch, because on a denture, the roof of the mouth is covered.
Right.
With dental implants, it's not covered.
Okay. Here's what plastic does at the roof of the mouth. Because the roof of the mouth has taste buds, it has salivary glands. You can taste temperature. You have your morning coffee. There's temperature going through. You take that for granted.
All right.
With plastic covering your palate, you're not getting that temperature feel. You don't know. So you've kind of lost that part, which is part of the enjoyment of having a hot cup of coffee. So it's a hot cup of coffee and not a cold cup, right? So you've lost that. Now, the taste buds that are there, you're not tasting a lot of your food. In fact, people that have had dentures and now with implants have taken that part of the plastic away, they can taste more salt, more sugar.
Do they like that the most?
Oh yeah, they can really.
Because I know you're a great cook.
I love cooking.
You say you're a great cook.
I like what I cook. Okay, so when you're eating, you want to taste your food. There's enjoyment, there's flavors, there's spices. This precludes all of that. And you resign yourself. Like I said,
like
human
wine
nature.
too. They always say the soft palate.
There you go. Wine is very popular. A lot of people drinking wine. Soft palate, the hard palate. you've got taste buds there, and you're kind of, shortchanging yourself if you're gonna have a good bottle of wine and you're not able to taste it.
Because of the roof of the mouth.
Yeah, exactly.
Do they like that? Is that one of the things they like the most? Just the fact that they don't feel like they have a piece of plastic in their mouth.
That's exactly the taste of foods. Okay, now your tongue wants to be there in the roof of your mouth. So we've got taste going. We've got temperature of foods, speech.
So how many implants for the upper?
Usually about 6 because of the quality of the bone. We could even do 4 sometimes if the bone
So
pans
6
out
implants
better.
for a fixed set of teeth?
Yeah. But I'd say with a denture, you're going to go 6, but you want about 10,
Okay.
8 to 10 for a fixed set of teeth on the upper. But here's what we find a lot, it's most people walk in, they've got a problem with the bottom teeth, with the bottom denture. They say, oh, my top denture is fitting fine. There's a lot more bone, so it is better than the bottom denture. Once we fix the bottom denture, we put the implants, and then they've got this problem taking it out. It's fantastic. They can chew. They can sneeze without that missile flying out of their mouth, And they come in, and now in comparison, the top denture doesn't feel quite as snug. Now they want something done about the top denture. So that's just the progression, natural progression where it goes.
So the future is, we are just about out of time, but the future is really no more dentures. Really. And when we say get a fixed set of teeth in just a few appointments, that's possible. And you're saying pain is not an issue anymore.
Not at all.
That they don't complain about pain.
It's not an issue at all. It is surgery. There's going to be a small amount of discomfort. Okay, and everyone's different in their perception of pain, how much they feel and perceive. And we give medications for that beforehand. Please take this because we don't want you to have any surprises. Not that you are, but we want you to be comfortable nonetheless. And about half the people we found out don't take that. We get one of the first implants I gave, I was guarded, so I gave my patient some Vicodin. I called him the next day, he says, I don't have to take any Viagra. There was some silence there, and I said, I'm not that kind of a doctor. And he said, oh, I meant the Vicodin. I said, okay, I don't want to know about your personal life. Okay. But he didn't have to take any of his medication.
All right. Now with, so on the consult, okay, so the denture wear goes in, what do they want to know every time? Like, what are the frequently asked questions that they ask you?
Will it hurt?
Will it hurt?
Yeah,
okay.
That's the number one question. Because when you think about it, it sounds painful.
Sounds terrible.
It sounds like it should be painful, but it's not.
Now, we should mention too, because you give great shots. One of the things you said, I give great shots.
I've been told, yeah. Because I give myself shots.
Oh, really? Okay.
Yeah. If I need dental
the
work,
injections themselves, they don't hurt either.
That's the thing of the past. We have what's called a topic, a little gel that we put on the gums before we give the shot. And I have that custom compounded from a pharmacy, sends it to us, and we use that. I've been able to do laser surgery on kids without shots just because of that gel. It numbs everything. What used to be before cutting, stitching, days of, discomfort, for orthodontics, for example, with that muscle attachments that they need cut. We just put the gel, let it sit for 10 minutes, use the laser, 10 seconds of laser, and they're done. Go, McDonald's, ice cream, whatever you want, you're done. We see you the next day. Doing fine, wonderful, on their way. So with advances like that, we're able to do these things. Things have come a long way from when they started. Things are a lot better. I love the way dentistry is going. I love to be a dentist at this
point.
Your
consultations are free. So if a denture wearer is watching this, and we're
Yes.
just about out of time, they could go in, and you will let them know if they are a candidate, how soon. Like how soon before they know that they could get this done, that they qualified to get this done?
Usually the same day when they come in, for the most part. I'd say about 99% of the time I can tell them right away that they are.
And not everybody's doing free consults, by the way.
They should.
And I'm not trying to side with you, by the way. Really,
Yeah.
I'm not. But I think that, look, and I'm not trying to side with you or endorse you, but I think everybody should do free consult.
Well, the thing is, I don't think it's fair that you come in, you pay me for a consultation, I tell you, well, we can't do anything. Now you're down so much money and yet in the same position as you were before you walked in. I think it's just equitable that you came in, you got some information. That's what we want to provide for you, is that information that you maybe didn't have before. This is what is possible. This is what we can do.
So I asked you about the consult. Okay, so they want to know about pain. They want to know, am I too old? What else do they ask?
How long will it take?
How long will it take?
The surgery themselves, because there's obviously a certain amount of trepidation about going through surgery. It's never an electable thing. Mm-hmm. Even if it's cosmetic, you still, at the day of your surgery.
So you're doing IV sedation? Yeah. What are you doing?
We're not doing any. We don't need to. It's just local. We just numbed local areas. Everyone's comfortable. We're having a good time. We're doing our work. And we've had patients before tell us that they really, really, family members bring them, our older folk that that they can't drive or whatever, and the sons and daughters come in and say, look, my dad is or my mom is really nervous. And I said, yeah, don't worry, you can all sit in the room and watch me do this while you're there. You can hold hands if you want to.
Are the patients surprised that it doesn't
Always.
happen very often?
One of the greatest things that me and my staff love to hear is when we're done, that's it. 95%
Do they
of
really
people
say that?
Yeah, that's it. That's it.
That's it. So,
Yeah.
but they need a ride home because there's a little bit of sedation
No,
going on.
it's just because they don't drive. If you drive, you can drive yourself home.
You can drive yourself home
Absolutely.
after dental implants.
Absolutely.
And you can eat within. I mean, you probably tell them, hey, take it easy at the first week or so, right?
No, just the first day.
First day.
Go home, catch up on your
Do you ever
shows,
hear
TV.
eating stories of these denture wearers where they call you and say, I just ate this or I just ate that or corn on the cob? Do you ever hear that?
Yeah, because we see everyone back the next day and a week from that, mandatory. Okay, just see how they're doing, how they're functioning, if they need any of our help. And these are the stories we hear typically. They're doing great.
Final message, though, and we're completely off time. Denture wearers watching this, they want more information. Just call and make an appointment.
Call, make an appointment. Come talk to us. You're going to love my staff. We're going to give you all the information you want. Take it home, think about it. Let us know how you want to proceed.
How long does that
But no.
consult usually last? Just because they have a bunch of questions.
Usually about half an hour, 45 minutes. If you want longer, we're there. We'll take as long as you want. We don't time it.
I want to thank you for coming to the show. Great
Thanks,
info.
Randy.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. Put in Dr. Nagrani's name, or you could put in dental implants, Hanford, or Central Coast. You could find them that way. And for those of you that are on Twitter, you could put hashtag Wellness Hour. Make a nice comment about Dr. Nagrani. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.